can you please explain about the locally advanced breast cancer and effective treatment plan?
So far we have discussed about various other aspects of breast cancer. We have discussed what is the stage, and we have discussed about early breast cancers as well. But there is a good number of breast cancer that comes in a little advanced stage. They are not actually metastatic, means they are not in stage 4 where they have spread into other organs. They are limited to the breast and some areas around the breast, what are called as lymph nodes. They may be stuck to the chest wall. So these are patients who have delayed to come to the doctor, but they are not totally out of treatment purview. So under these circumstances, there are two distinct categories of breast cancers which are called as locally advanced operable breast cancers and locally advanced inoperable breast cancers. Means in one group we can perform surgery, good enough surgery, a curative surgery, whereas on the other side we cannot directly perform. We need to give them some form of a treatment before we go for surgery, which is very important in these cases. Now, why is it so important to understand? Because in these kind of cancers which are locally advanced, it becomes mandatory for us to give all types of treatments. That is, these patients require surgery, they require chemotherapy, and they also require radiotherapy. So all forms of therapy, and sometimes even target therapy, and very often hormone therapy also. So it is a full range of treatment which is required in these patients. But in these, typically what we do is we ask the patient to go for chemotherapy first, or target therapy or hormone therapy first before going for surgery. And I want Dr. Adil, who is with me, to also discuss about the aspects of chemotherapy. What is it meant for? What do we really do, and why are we doing that? Adil, over to you.
Thanks a lot, sir. Yeah, so like sir already mentioned, locally advanced breast cancer, it is not spread to different parts of the body. So a patient who has taken the right form of treatment can still undergo cure. So here we need to ensure that the patient gets the full range of therapy, that is the chemotherapy, the surgery and the radiation therapy. So like sir already mentioned, although the patient may be operable, probably by giving a systemic form of a treatment before the surgery, will not only shrink the tumor such that the surgery becomes more amenable or more easier to do, but also it takes care of the micrometastasis. So what do you mean by micrometastasis is, suppose if the tumor is of a large size, some of the tissue may already be spread to a different part which may not be picked up by the scan. So this is more common in a locally advanced disease rather than an early disease. So when a patient is having a locally advanced disease, we have to give something called as a chemotherapy. Probably we are giving maybe 3 to 4 cycles. At the end of every cycle, we are seeing if the disease has shrunk. We are assessing the patient clinically, and if at all, there may be a very small number of patients who may have a disease progression even during the chemotherapy. So those things we are assessing after every chemotherapy, but more often than not, maybe say 8 or 9 out of 10 patients may have a good shrinkage of the disease, which will make surgery easier for the patient, and eventually the outcomes will be better. And they have seen a patient who has maybe undergone surgery followed by chemotherapy or a neoadjuvant chemotherapy, that is a chemotherapy followed by surgery, both of them have an equivalent outcome. So in a locally advanced disease, which is we are trying to give a systemic therapy before the actual localized therapy.
So in this entire thing, what we understand is, in a locally advanced disease, it is better to treat the entire body before we come to the local treatment.
Right.
So entire body means we are giving a systemic therapy. The entire system, the entire body is treated. That is, can be done only with some injection, which is chemotherapy, or some form of a tablet, that is hormone therapy. So this is the way it is to be understood. There are some other circumstances, like the patient wanting to save their breast but having a little advanced disease or locally advanced disease. Is it really possible to do surgery, or is it really possible to save their breast? It is possible, and it is made possible by again giving chemotherapy before doing surgery. So by giving chemotherapy, we shrink the disease and make it possible to save the breast, and effectively. Because what happens is, once the tumor is shrunk, we will be able to save the breast with sufficient normal breast tissue around it. So that also is a very important aspect of giving chemotherapy before doing surgery.